Hello, welcome to our series, 2-Minute Health Tips about Type 2 Diabetes. I'm Rick Benzel, publisher of New Insights Press, and I'm sitting here today with Dr. John Pudillo, author of several books on diabetes and cancer. If you have type 2 diabetes, this is a subject that you want to pay some attention to, or if you have cancer as well. Dr. John has written in one of his books called Surviving Cancer about the relationship between diabetes and cancer. Let me ask you this question. What is the linkage and the relationship that you talk about in your book concerning diabetes and cancer?
The best way to explain that is two of the organs that are highly susceptible to develop cancer in a person's diabetes are pancreas and liver. Question is why? When after a meal blood sugar goes up, the sugar stimulates the pancreas to release insulin. So pancreas is sensitive to blood glucose level and releases insulin. The liver responds to insulin and then adjusts the level of glucose release from it. So glucose and insulin are integral for the activities of pancreas and liver.
And those are the two organs that in a diabetic will have a tendency to possibly develop cancer.
Other organs also develop, but these two are very important. Now, how do these two factor into cancer? Cancer cells need energy and materials to multiply, and glucose provides that fuel for energy as well as raw materials for new cell construction. Insulin stimulates the workers inside the cell, they are called enzymes, to extract energy from glucose. So insulin is promoting the growth of cancer cells. This is why it is important to reduce your blood sugar level and insulin, not with medications, but by not putting whatever is that is releasing glucose in your body.
So if you are a type 2 diabetic, what Dr. John is suggesting is that it's extremely important to reduce your high blood sugar, which is glucose in your blood, and also to avoid increasing your insulin by taking medications that boost your insulin level or by injecting insulin. Because what you're saying is that glucose feeds cancer cells and insulin is a growth promoter for cancer cells.
Correct. So by reducing the amount of grain and grain flour products, you can reduce blood sugar, thereby eliminating or reducing the need for insulin.
What we're doing then is we're basically starving cancer cells.
Exactly.
If you are a diabetic, you need to be concerned about this because there is this tendency of diabetics to develop the certain kinds of cancer, liver and pancreatic.
Among others.
Among others. And if you are not diabetic and you're just simply concerned about having cancer because it's in your family, this is also something that you should be aware of. Thank you very much for watching.